Hey guys, welcome to another episode of the making of. Oh my gosh, I almost said Little Black Dress Pod, but welcome guys to another episode of the making of pod. I'm your co-host, Ashley Joves.
And I'm Collin Al-Samarrie. You're back in the building.
I am back in the building and it feels, and Collin and I were just talking about how this feels kind of nerve-wracking. Like it's our first time doing this. It's kind
It
of
took
weird.
us so long to get set up.
It really did. And this is, I think, the first time we've recorded with you being on a Zoom. Yes?
Yeah, I think so.
Yeah.
I wasn't feeling
Yes.
good this weekend. So I was like, I'm going to stay away from your house because we don't need to
And
share
now
germs.
I'm not feeling great. It's just this time of the year, but I feel like this time of year is always this time of year for me. Like it doesn't matter if it's sunny or whatever outside. But anyways, I'm really excited to get back into life as we know it. And before we get into the meat and potatoes, we're going to get started with a this or that because we got to break the ice call.
I know, because I'm so nervous.
So nervous. Okay. Skydiving or scuba diving?
Oh, um, scuba diving.
Great hair or great teeth?
That's a hard one. Great teeth. I feel like I have to say
Cardi-
that.
Cardio or weights?
Oh, cardio.
And camping or luxury hotel?
Luxury hotel all the way. Camping is awful.
I will go glamping. My gosh.
That is a
Okay.
luxury hotel, right? In
Yeah,
like Vale.
absolutely.
It's
Exactly.
outdoorsy.
So outdoorsy. Okay, so for skydiving or scuba diving, I would definitely choose scuba because I am so scared of heights.
Yeah, the thought of
Great
doing that is
hair.
awful.
I know it sounds that. Oh, this is gonna go down the rabbit hole. But did you watch Alex Honnold?
No, I think,
Oh my gosh,
did
I'm
you watch
getting
his
sweaty
first
thinking
one?
about it. I watched 3/4 of it and then we had to stop it because we had to get the boys down for bed. But did you finish Free Solo?
I did. And like I knew that he survived because you knew the outcome, but the entire time I was so anxious still. I can't.
I watched the skyscraper live, like
Oh
while
my
he was
gosh.
doing it. And I kid you not, I was so sweaty. Like, I'm sure if I checked my heart rate, it would have been escalated. And I'm so scared of heights that the entire time that he was climbing, I felt weak in the knees. Is that weird? Like, just
You're like,
watching
well,
it. But it was insane. Are you going to watch it?
I think so. Yeah, I want to. I'm curious.
It is, he is incredible. Obviously, he doesn't die. It's just amazing. And if guys, if you have not seen Alex Honnold's skyscraper, he climbed Taipei 101, which is, I think they said over 1,700 feet without a freaking rope. And they were showing images of the people inside the building taking
Mm-hmm.
his videos. I'm like, oh my gosh. And he would stop and wave at people. I'm like, this guy.
He
Oh,
was from this area.
he's from SAC. Very cool. Yeah. No, he's so amazing. Okay, so I would choose scuba diving, even though I am also scared of the ocean.
Mm-hmm.
But I think I'm a little less scared of the ocean. Little bit.
I feel like you could go scuba diving not too deep, just like very shallow water.
Is that called snuba or snorkel?
I mean, if you have the tank, right? That's not scuba
Okay,
still.
yeah. I think it counts. I think
Yeah,
it
I think
counts.
so.
Okay. Great hair or great teeth? Definitely great teeth. I think I would be weird if I chose the hair, given my
Mm-hmm.
current profession. And cardio or weights? Netflix.
That's
Uh,
exercising the brain.
yes, yes. I would prefer maybe weights because I'm so lazy. Like to
Yeah.
get my heart rate up. I don't know. Like hit workouts, just although I need to do hit workouts because my HRV is just horrendous.
Okay, speaking of this, here we go, sidetracked.
I know. We don't have an agenda, guys. We're just gonna talk. That's what
This
Collin and I are good for.
you were just privy to our random conversations, basically. Um, I started taking magnesium glycinate and my HRV has gone up now.
Oh, I
You
take
should
that
try it.
also at nighttime.
Oh,
Has it improved your sleep?
I think so. I mean, according to my Aura Ring, it has.
You've always been a good sleeper though. You can sleep anywhere.
I can fall asleep anywhere. Yeah. But I usually wouldn't sleep like too much. And my HRV was always really low still. But now that I'm taking the magnesium, my HRV has gone up. Um,
Nice.
which kind of magnesium do you take? I'm taking the powdered kind.
Capsule form, so I guess
Okay.
powder. Yeah.
I don't know. That was like just a side note.
I think that is amazing. I need to definitely work on that because mine is like my heart is struggling. It's
What
like
was your HRV last
chug,
night?
chug. Oh, it so I actually it's been so bad. Like my current state it's just been awful that I have not worn my Aura ring in 2 months, I think.
Oh, okay.
But I have it charged today.
Okay.
So I will let you know. I'll give you an update. But like when you're just off the wagon, well, at least for me, when I'm off the wagon, I am like, there is no wagon in sight, not even a
Yeah.
little bit. It's really,
Yeah.
Brian tells me this is how nerdy we are. Brian tells me I'm an action potential. It's all or nothing. So,
No
so
way.
yeah. Okay. I should make a shirt that says that. And then if you get it, you're a nerd like me. Yeah.
Yeah.
Okay. And then what was the last one that, oh, camping or luxury hotel?
Mm.
Uh, is there even camping as an option? Like, seriously, camping? No, no, no.
Mm-mm. No, thank
Like the
you.
people who just have a backpack and a tent. I'm like, what?
Why?
If this is you, I commend you. I am not that person. Like, I could never go sign up for, how, well, yeah, I think they still do this, but at like high schools and colleges, they have the people recruiting to be in the armed forces. And
Mm-hmm.
then in dental school, they were recruiting hardcore. We'll pay for your dental school debt, blah, blah, blah.
Yeah.
I would not survive boot camp. I'm like,
No.
if I can't have my basic necessities, there's just no way. Just send me home. No,
Yeah, if
no,
I have someone that has to yell at me to do all these things, I'm good.
no,
No, thank
exactly.
you.
No, thanks. All right, so this or that, we are done with this or that. We're gonna get caught up with all the life stuff. I mean, Collin has been amazing at taking the reins and continuing to record. In case you haven't noticed, I haven't been here for a while. I think it's been beginning of December. Was that my
Yeah,
last
around there.
recording? And I secretly ducked out, and Collin became my protege co host and just keeping the uploads going, which Collin's just been incredible throughout this process. If you're a part of our community and you follow me on Instagram and Facebook, and you are a receiver of our newsletter, you finally know the reason why. And that is because we found out a week before Christmas that Brian's cancer was back. And so life has just been lots of ups and downs, mostly downs. And we're going to jump into that. And like, I just felt this need to, I wanted to share what was happening behind the scenes. And Brian, he just wasn't ready yet. I mean, he didn't even know that I posted on social. I kind of just did it. Like I can't just disappear and, like make it go away. Like I think it was a part of him. Well, he's very private when it comes to himself. Like he likes it when I share about Smile and Co. and like this community and our retreats, but anything about our family per se, like he likes to keep that close to the vest. And That's not in my nature. Like, you guys have heard everything about my life pretty much, from starting the startup, starting Smile and Co, to the trademark stuff, to like employee stuff, like your first fire. You guys have been through it all, like mom guilt and having a surprise pregnancy with Cody. And I've just felt so connected with so many of you, and not just via the podcasts and social media, but through our retreats. We've been able to really get to know each other in person. And I really do consider this community as our extended family. So, where do we start?
I didn't realize that you didn't tell Brian you were doing that post.
Oh, no. No, he would have kiboshed that real fast. Yeah.
That's interesting because the first diagnosis, and when that was all happening, wasn't he kind of encouraging you to? That was kind of after, though, huh?
No, he didn't want me to share either.
Oh, really?
And then as soon as he left for work, I went on the podcast
Okay.
and I did that solo episode because he was going into surgery the next day. So this
Okay.
was like his last day of work, and he left. And then I like debated whether or not I should share, but it was something that I really wanted prayers for. And I'm like, I don't care what Brian says. I'm gonna ask. I'm gonna ask for all the prayers.
Yeah. And I mean, just seeing, I think, just off of the first time and when you did that, like just the impact that that did have on so many people.
I
Right.
think yes. I don't know about you guys, but I mean, I've been practicing for 16 years. And then if you add the 4 years of dental school, it's 20 years in dentistry. And I can count on one hand the amount of people that I have seen with oral cancer. Like, it was like thousands of oral cancer screenings. We do it for every new patient, we do it for every recare exam. And it becomes so like, it's second nature, obviously, to look in our patient base, but it's so rare, or at least you think it's so rare, that you become complacent. And I mean, we're still looking, but are we looking as intently? Are we really going through a patient's risk factors? And speaking of risk factors, Brian is not in any means like, it wasn't HPV. He's never smoked. He flosses every night. He's never had a cavity, like never had a cavity. He never gets sick. Out of all the members of our household, all five of us will come down with like the craziest flu, and he's a bull. Like, he has never called out sick for work. Anti-medication. He works out at 5 a.m. every day. He eats healthy. He has a master's in nutrition, and he worked as a personal trainer. Like, if you think of a guy who is at his prime, like killing it in his profession and killing it with his health and wellness, he's the poster child. And one thing that I still beat myself up for is just that guilt. Like, how could this be? How could I have gone through all of these thousands of oral cancer screenings, and the one place that I would have never in a million years have expected it to be is in my home, literally lying next to me every night while we go to sleep. And the way Brian's schedule is, or was, he's a physician, so he works busy hours. And when my office is open, it's when he's seeing patients. I'm not open on the weekends. And it's one of those things like, hey, you haven't had a checkup in a while, but you know what? Do you have any symptoms? No, you're good. I hadn't done an oral cancer screening for a couple years because he had fallen off the wagon. And when he first told me that he had tongue pain, this was back in June of last year, I was like, bro, you probably bit it. Like, he's a fast eater. He's always on the go. I'm like, I didn't even check, call. I
Yeah.
literally was like, give it some time. I'm sure it will resolve. And the first time he told me, I was actually working at the Folsom office. And he texted, he's like, hey, like my tongue kind of bothers me. Will you take a look when you get home? I was like, yeah, sure. The whole day goes by. I'm seeing these patients. I get home. I'm tired. He's tired. I completely forget. No, we're good. And he didn't bring it up. He's not nagging me about it. And then a couple weeks later, he had mentioned like, hey, I have like something in my ear. Like it feels like almost like an ear infection. I was like, well, you haven't been to the doctor in a while. Do you want to make an appointment? And of course, that is an inconvenience because he's a doctor and he's always with patients. So he had one of the doctors in his office just check his ears, and they're like, no, no infection, you're good. And then it gets dismissed. And then we went to Rome because I spoke there. And this was in July now. And it's just crazy to think in that like time, like I look, it's hard for me to look back at our Europe trip because I see like all our photos and videos, and he is so vibrant and healthy. And then who would have ever thought that a couple weeks after that trip, I would have found oral cancer? It just, it feels like a nightmare because it is.
Yeah, I mean, it's one of those things though, and you think about it. I mean, even still, right? Like I'm due for a physical or annual or whatever. Like we just kind of don't think about things like that, especially when there are no risk factors, because it just doesn't cross your mind.
No.
And even talking to Hero a couple weeks ago, because her dad had oral cancer, and she mentions too that even in school, you guys learn about it, but it's not like a huge section of your learning, right? Like they kind of talk about it because it's not common.
It's not, yeah. I mean, my pathology professor in at NYU, he would be so on it with the oral cancer screenings. But you're right, there's so much that you have to get through in that curriculum in 4 years, that they teach you what to look for, the warning signs, leukoplakia, dysphagia, difficulty swallowing, but you don't really dive deep into like symptoms per se. You do a quick screen with a gauze, you have them stick out their tongue. But if anything looks even remotely, is that something that gets sent to oral surgery residents because they need to be training for that. So the general dentist or the students studying general dentistry, you kind of just refer along. And yeah, no, it's definitely been an eye-opening experience. And I'm so grateful that so many of you have reached out and have said, like, yeah, we are screening people in our homes, like our husbands. Like, as soon as that episode went out, so many of you texted me and were like, I am screening my husband right now. This is terrifying. And it is. And so, just some backstory. So, Brian had his first surgery. If you didn't hear my other episode about Brian's whole cancer journey, I found it on a Monday in July, like towards the end of July, right, Collin? I think it was. And I saw the leukoplakia on the right inferior lateral border of the tongue. It was still pretty forward. It was pretty anterior on the tongue, and it was 2.5 centimeters in size. Brian had his first biopsy the next day. That biopsy was taken towards the front part of that lesion, and it was sent to path. We wait a week. The path results came back negative for cancer. So basically just saying dysplastic. Well, if you have a gut instinct about something, just make sure to be an advocate for yourself, because that didn't sit well with me. I encouraged Brian to get another biopsy. And so actually on my birthday, August 12th, we were at an ENT, another ENT, and Collin was so great. She met us at the parking lot because I saw how painful. I mean, your tongue is a very sensitive muscle. I had Collin bring over some 2x2s, a syringe, because my plan was to block him in the parking lot before he went in. Because keep in mind, they had already cut a chunk of his tongue just a week and a half before. We're back, and I'm having them do a second biopsy. This time it was on the posterior border, and the ENT sent it, or he got a really significant chunk of it to just get all the different levels of epithelium. And then we have to wait another week. But in that time, after that, after having that second ENT look, he's like, okay, well, this looks very suspicious. The next day, Brian had his CT, and then we had a follow-up appointment with, or not a follow-up, like our initial appointment with UC Davis, head and neck cancer, that Thursday. So my birthday was on Tuesday. On Thursday, he was at Dr. Bewley's, the otolaryngologist. Is that how you say it? Yes. So he specializes in head and neck cancer. We were there, still not with the path results, the biopsy results, because that still takes about a week. And as soon as he saw it, he's like, if it looks like cancer, if it walks like a duck, it talks like a duck, this is absolutely cancer. And that's when I texted Collin and Judy, like we were leaving UC Davis, and I basically said, it's cancer. And then that's when I think I saw Brian cry for the first time. I think there is, even if you suspect cancer, until you hear that diagnosis, a lot of people say there's life before cancer and life after cancer. And your life after you hear that diagnosis is never the same. And like we stopped at a place to eat in East Sac, and that's when I texted you guys, and then we were both just like crying in the restaurant. And yeah, we were gearing up for probably the hardest fight of our lives so far. And because of what it looked like, the surgeon said, okay, it's Thursday afternoon. I am not supposed to be seeing patients on the following Tuesday, but I will meet you in the OR. And they basically made all the stars align. Brian was seen at UC Davis that following Tuesday, and he had a 6-hour procedure. Collin met me there because Collin's just the greatest human being ever. She sat with me all those hours in the cafeteria, and they removed a third of Brian's tongue and 34 lymph nodes in his neck. And that was also the day that we got the biopsy results, which is crazy, right? You don't think that you are getting rushed into surgery, or at least scheduled in surgery, until you have all the data. But it basically confirmed squamous cell carcinoma. And then, I mean, all of his lymph nodes were sent out. So during the procedure, they do what's called frozen sections. They're basically doing different slices of the tumor, and then they're making sure that they're getting clear margins, right? So they're running it to the lab. The pathologist is looking under the scope while Brian is still in the OR, and they're doing that multiple times. I think they said they had 4 or 5 different slices. And then the surgeon thought that everything was great, and they closed up shop. And then 2 weeks later, for Brian's follow-up visit, the surgeon basically said, there is an area that we found it on the way back, the way posterior part of your tongue, that the margin was a little too close for comfort. At this stage, his staging was still stage 1, no lymph node involvement, thank God. So all 34 lymph nodes were clear. But because of the margin, because it was only 1 millimeter, what is it called? 1 millimeter buffer zone, I guess. He wanted to go back. Labor Day weekend, which was, I think, that following week, he booked Brian as the last case of the week. And Brian was back in the OR, where the surgeon took out an additional 2 centimeters on the backside of his tongue. So in the span of 3.5 weeks, Brian's tongue has been cut open 4 different times. And then we thought it was good. Like, we were like, okay, no cancer. We got to it. Lymph nodes are good. Thank you, God, for this prognosis and all of that. And then
this is like mid-September now?
Mid-September. Okay. And we were like celebrating so hard. We're like, this is a wake-up call. And I mean, Brian still, he was eating. So one of the things that we were following was a more keto-based diet. And by we, I mean he, because I have no discipline. But a lot of tumors will feed off of glucose. So Brian has been really diligent about not even eating fruit. Like, he's been eating just meat and vegetables, like, and that's it. And we were now, what is it? So that's September. And then after you have a surgery like that, or after any cancer diagnosis, your surgeon wants to follow up with you. And so instead of, like, you're good, we'll see you in a year, they want to follow you more closely. So at the 3.5-month mark, Brian had a follow-up CT with contrast. That was at UC Davis. We had that done November.
Like November? Okay.
Yes. November, we had it here at the UC Davis campus. And Brian had heard from his surgeon, and his surgeon basically texted him, and he said, thumbs up, you look good, enjoy your trip to Hawaii. And we spent Thanksgiving in Hawaii, just so grateful for everything. And come to find out a week later, because the radiologist finally did a read on his CT, and it was like, everything looks good. However, there is something that looks like it could be recurrence forming and this was towards the back of the tongue. And then Brian had his follow-up with the doctor, and the doctor basically said, like, at first glance, I thought that we were clear. And then after the radiologist read that, like, he basically said, I missed it. And he did another biopsy. So Brian, apparently he developed a cyst on the back of his tongue. The surgeon drained it. He got out about 2 cc's of fluid, sent that to PATH, and then he did some incisions and sent that tissue off to PATH. And then the next day, Brian got a call while he was at work, and the surgeon was basically like, I think it is what we think it is. And that was, I think, the second time that I've seen Brian cry. And I mean, it's just been, after that, we had a PET scan done. So a PET scan, you're injected with a fluid that has glucose in it. And then tumor cells, they feed off of glucose. So in your scan, if it lights up, it is basic. It basically will show if there's been any metastasis. And sure enough, the PET showed up a very large, I wouldn't say very large, but it was about 2.5 centimeters. There was a 2.5 centimeter mass along the floor of the mouth on the right side, like approaching his mandible, as well as 2 different lymph nodes. And then we were called in to UC Davis a few days after that. Oh, no. So Brian had the PET scan. This was a Wednesday. He had it at UC Davis in like the early afternoon. I left Roseville early because his appointment was at 2. And 5:30 p.m. that same day, Brian on his cell phone got a call from the surgeon, and the surgeon was basically like, I haven't seen something like this. It's really aggressive, and we have to do something quick because it's spreading. And so Brian's previous stage 1 is now a stage 3. And I mean, this is right before Christmas. We were getting ready to have our backyard be like they were gonna have tents put in our backyard because we were hosting 60 family members in our home for Christmas, and we got the call, and now I'm bawling in the kitchen. And that was the same night that we told Hudson is our oldest, that dad's cancer came back. And I have never heard Hudson cry like that. Like, it was heartbreaking. And that's what it's just been. This whole season has just been such a heartbreaking journey for sure. So, do you have any questions? I've been talking a lot. Giving up.
No, I mean, I feel like it just, because I've been with you through this, and I mean, even just in the last few months, I'm like trying to think back, and yeah, it's crazy how fast everything happened and how it changed so quickly, I think.
Yeah.
And yeah, because I was looking back at the calendar. Adrian and I went to dinner with you and Brian on December 12th, I think it was. And you didn't even know then, right? Like, he had maybe had some of the testing done, but I remember that wasn't known. And then the following week is when you guys had your family party. And so that's the week that you found out, which was, yeah, literally like a week before Christmas.
We found out 2 days before the family came over. And I kept asking Brian, I said, like, this is a lot. This is so much that we are going through. Do you want to cancel? And he's like, no, absolutely not. And don't tell anybody. So don't tell our parents. We don't want anybody to worry. We want this to be a celebration of family. And I don't want this to be about me. He was very adamant about that. And that was December 18th is when we found out. And then we were in the doctor's office, I think it was the following week at UC Davis. And they basically sat us down and said, this tumor is moving quickly. We want to prepare you for just the different options available for you. Option A is we move right into surgery, but we have to warn you, this is a much bigger, more aggressive surgery. We have to make very wide margins. So we have to take out half of your tongue. We have to do a transplant from your leg, put that where the half of the tongue was, and then clean out the floor of the mouth. And you are going to be in the hospital for no less than 6 days post-operatively. So that would have been Christmas, because they were trying to, if they were going to do it, it was going to be that following Tuesday. And then the other option was, we're going to attack this from all angles. We're going to get you started on immunotherapy, chemotherapy. We're going to see how your body is going to respond to this, see if we can get this tumor down to size, and then it'll hopefully be a less invasive procedure. But if it doesn't respond with how fast it's growing, that is a risk that you're going to have to discuss with Ashley, think about it. And we kept saying, like, what would you guys do? Because now we are in the room with two surgeons, and they basically said, we honestly don't know what we would do if we were in your position, which is, it's never comforting when they can't really direct you, because either option seems not great. And we, on the drive home, one of my friends is she's an ENT surgeon. She worked at Stanford for a long time. And throughout this entire process, I've just been relaying any messages to her, just as another set of eyes for us and an advocate. And so she's been receiving all of Brian's path results, his CT, his PET scan read, and she brought it to her head and neck surgeon, because she does mostly just ENT surgeries. She doesn't specialize in cancer. And her surgeon basically said, don't waste time with chemo. Just get in there, get this disease out, and be done with it. Like, time is of the essence. If you were going to dilly-dally, that could be potentially 6 to 8 weeks of this tumor growing. So then it was
I didn't know that part.
Oh, yeah.
You never told me about that.
We got this call literally on the drive home after we had just left, like, one of Brian's appointments from Davis.
Yeah.
And now we're like, what do we do? It's going to be Christmas. But more so, it's a very invasive surgery. Mm-hmm. It's terrifying. And ultimately, Brian felt more comfortable starting with chemo and immunotherapy first. So he's had 2 infusions now, and he's lost a bunch of weight. Right now, he has immunotherapy rash. He developed chemo rash 10 days after his first round of chemo, which is basically his entire body broke out in hives, like really itchy, angry, hot. He couldn't sleep at night because if you apply pressure on it, it was just unbearable. And Brian is such a soldier to a fault. I kept telling him, like, you need to tell your team what is happening to you. Like, you literally, you're a walking, it looks so bad, like really bad. And he's like, no, I'm fine. I can deal with it. I'm like, but you don't know if this is like a side effect that isn't normal or something. Like, do they need to adjust anything? And that's what Brian didn't want. He didn't want to raise flags, because he just wanted the highest dose of drugs that he could get. But then they put him on a steroid, an oral steroid, because it was so bad. And now his head is in that same position, and he's lost his hair. So I think that was the hardest thing for Brian. Like, just, even if you are preparing, like, mentally for that, like when you're showering and you get clumps of hair out, it's just, yeah. Until you live through it, you can't really explain how you're gonna respond. And that was it's traumatic. Like, this whole process has just been so traumatic.
Yeah. And I think just from when I've talked to him and stuff too, and yeah, the rash, like you said, I was talking to him about it. And he's like, I don't care how many steroids I have to take. He's like, I just want the meds to work, basically. But getting that rash, I mean, it is a sign of your body responding to something, right? Like you know your body's
Yeah.
taking that in at least.
Yes. Yeah. And anything that is negative that he's been experiencing, I keep telling him, I'm like, just think of it as the tumor cells dying.
Mm-hmm.
Like that's, and your hair is going to grow back. You are going to regain your weight. You're going to rebuild all the muscle that you've obviously lost. His legs are like this big now, like itty bitty. I'm like, your legs are getting smaller and mine are. Yeah, it's
What exactly is the immunotherapy?
immunotherapy. So the current drug that he is on, it's called Pembro. And so immunotherapy, so he actually, let me back up. He had the option of only doing immunotherapy, which is basically utilizing your own body's defenses, but just kicking it up a notch. So there are on the surface of the tumor, there's a certain receptor that they have to do a test to see if your tumor has these receptors, and it will activate that. So Brian's did,
Okay.
and one of the options was just taking this. However, with that being said, it's less um, it's less aggressive on your healthy cells, so you don't lose hair, you don't have a lot of the negative side effects that chemo has from being a toxin basically flushed in your body. But clinical trials show good results, but it's not guaranteed. Everybody's different, and your effects are slower because you're activating your own body's response. And Brian didn't want that, especially with how aggressive this tumor was behaving. Like we just wanted to throw the kitchen sink at it and hopefully have it start regressing.
Okay, so you mentioned that he's been through the 2 rounds of chemo already. You didn't really touch on going to UCSF
Oh yeah.
for a second opinion, and kind of the imaging there. I don't know if you want to.
Yes. Yes. So I think anytime you're in a situation like this, I mean, head and neck cancer is no joke. Any kind of cancer is no joke. So if you have an opportunity to seek another hospital or seek another pair of eyes, I would strongly recommend it. So one of my contacts, I know someone who works at Cedars-Sinai, and he basically has a contact at UCSF. And he said, it's completely up to you, but this is available to you should you decide you wanted to meet with this other doctor. So this doctor is basically a very renowned doctor, specializes in head and neck. We were able to get on his schedule within a week and a half over the holidays, which is especially unheard of. Like the only reason why we got in is because of my contact. And he met with Brian, and he basically said, we just want to do some more testing just to have another image of it. And he said he recommends the MRI, which is Brian at this point, he's had CT with contrast and PET scan. He hasn't had an MRI. He's like, I know it seems like it could be overkill, but our MRI like protocols are very solid here. And to really see if the chemo and immunotherapy is working, you want to have a baseline image anyway. So we had that done. And then he also had, it's called fine needle aspiration. Basically, that same day, they were able, everything has just been so amazing. They were able to get us into the pathologist. Like we had to wait a few hours, but the pathologist using ultrasound stuck needles in two of Brian's lymph nodes as well as the base of the tongue, Collin, going from the outside on the chin. So I'm watching this. Yeah, it's poor Brian has just been through so much with all these tests and biopsies, and the biopsies, that the results came back negative, which is amazing. But then when we brought the results back to UC Davis, because he had already started his first round of chemo at this point, so we didn't want to disrupt that. The doctor that did the original surgeries was basically like, I wouldn't think too much of that, even though it was like a positive, like it was a good thing, right? He basically said they could have not gotten enough cells, or basically don't get your hopes up, which is, I mean, it's tough, right? Like I don't know. We already had our hopes up and then it got crushed. And now it's like you want to be cautiously optimistic, but also lean on faith to carry you through. Because I tell you what, if we didn't have faith, there have been so many days where I have just broken down in the office, where I literally walked in to morning huddle with my eyes already swollen, like I was crying in my car, and I could not function. And yeah, today I'm choosing to stay optimistic, and I'm trying very hard not to cry, which is, yeah,
You're doing so well.
So thanks. I have to thank Collin for so much. Like, she's been through the ringer with us, and she was here helping to set up our holiday party. And
You guys, it was also like the worst storm. Brian and I were out there trying to, and I'm just trying to laugh about it now because Ashley wanted to save a little money on these tents and lights that they rented and not have them string it up for her.
Yeah.
So Brian and I are out there and it's like pouring down rain, because that was this awful storm we had right before Christmas.
It was so bad.
String up all these lights. And Brian is such a trooper, because you guys had literally just got all this information.
Yeah.
I think by the end of it, he was like, so done.
He's
like,
so done.
I'm not doing this again.
No.
Just
and I told
pay
him
the extra couple $100, whatever. Let them hang it up.
He was so mad at me that I cheaped out on that part. He was like, really? This is the part that you're going to cut out? Like the whole install? I'm like, I'm sorry. I was trying to save you money.
It was like they had 2 tents in their backyard, and one was like a big one for like a bunch of tables underneath. And I think you guys had
20-foot tent.
Yeah, okay, 20-foot tent, and like what, 4 tables
we
underneath?
Had 4 rounds. Yeah.
And then they had a long, like, tent with no sides.
Yeah.
They have this other long part of their backyard where they were going to set up the food. But Ashley, not knowing that the storm was coming, didn't order the sidewalls to this other tent. So they're looking. So Brian's went to Home Depot and Lowe's, and then back to Home Depot to try to get tarps.
Yep.
To hang up on the sides of the wall.
Oh my gosh. So bad.
You guys.
And this is a day after he got his diagnosis, and now he's like doing homework for me in this, braving the storms.
He was like out there in like his nice khakis too. And I was like, Brian, do you want to like put different pants on? Because it's like wet, and he's like climbing on this ladder. He's like, no, I'm just a minimalist. I don't want to do laundry. And I was like, oh my gosh. I was like dying laughing. I'm like, what's happening right now? Ashley's inside trying to make the sourdough.
just gonna say that if you guys are following my Instagram, I've been baking galore. I've been fully invested in sourdough because it has been the biggest distraction, just growing it, feeding it, and like baking and eating it. Oh my gosh. And that is also thanks to Collin. She brought over her starter and taught me how to bake it. Yeah. It's so that's basically the end of 2025 in a nutshell. And then now Brian has his follow-up visit on Thursday. They're going to do another ultrasound to see if there's been favorable response to the chemo and immunotherapy. And then the goal, I think, is to continue with one more round. So one more infusion. And then after that, he'll have his follow-up MRI, which we'll do at UCSF, and then create a game plan for surgery. And yeah.
So real quick, so follow up this week to see if the tumors responded to the chemo.
Yes.
So to see if it's grown.
So the surgeon uses an ultrasound, and he places the ultrasound right on the inferior border and the right side of Brian's mandible area. And he also checks the two lymph nodes, because two lymph nodes were coming in hot. They call it hot because they lit up during the PET. So they show more activity there. And so fingers crossed, prayers. If you are a believer or if you pray to anything, we certainly welcome your prayers, guys. I've read all of your messages. I may not have responded to each and every one, but I promise you, they have given me such a tremendous amount of comfort during this crazy time. And I'm just so grateful for you all. And yeah, I keep telling Brian, it's one blip on the radar. We're going to look back at this time and be like, remember the things that you survived, quite literally. And I mean, even just thinking about the things that I was so worried about in the offices, just a week and a half before we got Brian's diagnosis, it's so wild to me. We stress out so much over things that in the grand scheme of things don't matter. If a problem can be fixed with money, it's not a real problem. And Katie Toe was the one who told me that. She's like, Ashley, if you can throw money at something and make it go away, it's not a real problem. Your health is wealth. And it is, we are waiting to get wealthy again. I just want all the health. So prayers up, guys. And thank you. I'm sending you all so many hugs. And I appreciate you all so much. And I'll keep you guys posted because, that's what we're here for. We want to share all the things, life in general. And speaking of too, it's just been on my heart for a while. I know that we are a very startup centric podcast, and we're documenting Tony's startup. We're starting our next season, so stay tuned for that. But if you are in a place that you just want to talk about something about life, anything, and if you even wanted it to be an anonymous conversation, I would love that. I think we don't have enough of those conversations. I think that it can be when you are in it, like you look at the granular, you feel like, especially when you're surrounded by amazing dentists on Instagram and social media, it can be very toxic. And sometimes the real problems are not the things that are being discussed, reach out to us if you want to have a conversation like that. I mean, we're here for you guys.
That's all we've got, really, right?
Yep,
Each other.
absolutely. Absolutely. Any last thoughts, Call?
I don't think so. I think now you've caught everyone up on what's been happening because I know people are like, where is Ashley? It's so good to have you back. And yeah, I just think you sharing your story, like this is just a part of your story. And I think it can help a lot of people. And I hope that it helps you to share as well so that you know you're not alone and the others know that they're not alone in this. Yeah, that's where I'm at. And I'm happy to have you back.
I'm happy to be back, and I'm happy to have you like just pushing me to. I almost didn't record with Tony and you guys last week. Was that last week?
Something
And
like that.
and I was like, Colin, I can't do this because I had spent that morning crying, and she's like, it's gonna be good for you. You're gonna do it.
I kept wanting to be really sympathetic, but at the same time, I'm like,
Nope.
no, she's
Yeah,
got to do this. Like,
you
she's
got
got
to
to
do
do this.
this.
It's just an
You
hour.
got
It's a
it's
little
just an hour.
distraction. And you did
Well,
so great today.
oh, you did great. And I'm just so grateful for you,
Grateful for you.
for all the things Colin has just carried us through. And I'm not going to cry
You
about
carry
it.
me through. It's okay. We're not going to cry now. We made it
We're not
this
gonna
entire
cry.
episode. And we actually have to jump off because you've got a call with someone that we're going to do another series on, another season.
Yes, we
It's going to be so
do.
exciting.
Yeah, I'm excited. Thank you guys. And thank you, Call. Love you all. And we will catch you next week. Take care, guys.
Yeah.
Bye.